So going ahead with the slogan of this year, I am and I will. For this year's Cancer Awareness Program on the 4th Feb, we would like to re-emphasize on the importance of cancer awareness in the public in the form of screenings for early detection, taking care of one's own health, to be aware of our body. That's very important, especially in this fast pacing gadget world nowadays, and to clear the myths which are existing in the society. So let us start with something about chemotherapy safety concerns. So what is chemotherapy? Chemotherapy is nothing but a powerful and strong medicine which is used to combat or fight cancer. Cancer cells are very smart, genetically and intelligent, and hence the treatment used to fight out cancer, that is chemotherapy, also has to be smart, because it has to give 100% benefit to the patient. This benefit can be in the form of a complete cure, or it can be in the form of a prolonged survival, a better quality of life, and many more, barring a few manageable side effects which can be tackled. Now let us focus on chemotherapy safety. So as I said, that chemotherapy is a very strong medicine. So definitely the handling of chemotherapy and administration of chemotherapy has to be very safe. It's very important. Now, the safety concerns regarding chemotherapy are for medical and nursing staff, and also for the patient and the caretakers. Now what are the safety concerns for the medical and the nursing staff? It's very important to follow the universal safety precautions that are a must, and that starts from basic hand washing techniques. Now this hand washing is a very simple and powerful technique. It just decreases the chances of acquiring infection and transmission of infections during administration of chemotherapy. The second thing is, the nursing staff should be using a complete personal protective equipment. Now this means the nursing staff should be using mask, gloves, cap, and handling the medicines in a proper manner. Now all this also requires a designated place. The chemotherapy should be happening in a designated place, ideally such as the oncology daycare or a onco ward, which is designated only for this purpose, wherein we have a trained medical personnel and a trained nursing team who are capable of handling all sorts of errors and safety concerns. So coming forward with the nursing staff, the next comes the actual chemotherapy handling. Now before chemotherapy is mixed actually for the patient to be administered, it's very important to see the chemotherapy medicine expiry date and any visible particles, whether it is good or bad, the visible structure. Then comes the chemo drug chart, wherein the pre-medications should be given properly, and the exact drug, the duration of the treatment, chemotherapy, the dilution of the medicine, the administration, route of administration, all these things are very important, and these are doubly checked by a second nursing staff with a signature, and also thirdly checked by a pharmacist who also checks everything again. The oncology nurse should always remember to be extra vigilant, to take care of oneself first before taking care of others. This is very important, and they should use sterile gloves as much as possible during handling of chemotherapy, during administration, during mixing, even carrying the medications to the patient, connecting the tubings, disconnecting the tubings. Always use sterile gloves and alcohol swabs as much as possible. That's very important. Now we come to the safety concerns regarding the patient family, the patient himself. The safety concerns regarding the patients and their caregivers. So as such, there are no particular restrictions for the patient and the family. But usually what happens, this powerful treatment which is so beneficial for the patient has some side effects, and patients has a tendency to develop low blood counts and low immunity, and the chances of acquiring infections becomes more. So we try and tell them to avoid crowded and dusty places, and all possible sources of infection should be avoided. mainly the air, food and water. So try and avoid marketplaces, crowded, dusty places, and have water as much as possible, the AquaGuard filtered water or a boiled and cooled water, and try to avoid food which is from outside, and as much as possible it should be home cooked fresh food. That is the baseline. And fruits, they can have everything, especially the fruits which have thick skin, so that the chance of acquiring infections is less. And fruits with thin skin like grapes and papaya, we generally tell them to avoid because there are a lot of pesticides that don't go even after thoroughly washing. Now comes the other aspects, like if patients body fluids, like patient vomits or their clothes are soiled. So such clothes and such things should be cleaned thoroughly and separately. That's very important because there are chances that chemotherapy is secreted in the body fluids of the patient. So it should not be mixed with the clothes of the other family members. So above all, it's very important to have an ongoing continuing medical education to spread these safety concerns and simple steps again and again, and to reinforce these guidelines in our system. So let us aim for a happy, healthy and safe working environment which automatically enhances the safety.